Okay, hello. Thank you to everyone who just joined us. Again, this is the AssistRx Leading the Market in a Rapidly Changing Patient Solutions Landscape webinar series. My name is Bridget Brennan. I am the Senior Director of Marketing and Communications at AssistRx. I'll be your moderator for each of the panel-based webinars in this series. Today, we're holding our third installment of the series, taking your education, engagement, and adherence programs from acceptable to exceptional. Before we get started, I'll have each of our panelists introduce themselves, starting with Jan.
Hi, hello. I am Jan Nielsen. I am the division president for AssistRx Patient Solutions, and I am an RN.
Hey everybody, Brock Vandersteen, great to be here. I'm VP of Business Development at AssistRx. I've been here for 3.5 years, and I partner with manufacturing partners to drive access, affordability, and adherence through tech and talent solutions, whether commercializing a new product or enhancing an existing program.
Hi, I'm Charlotte Lee. I'm Patient Solutions Program Manager. I'm a registered nurse by background, and I've worked in patient solutions for a number of years, working with a variety of product launches and setting up adherence programs.
Wonderful. Thank you, Jan, Brock, and Charlotte. So before we dive into today's panel, I want to let all of you know that we welcome your questions for our panelists throughout today's session. To submit a question, you can do that at any time using the Q&A tab at the bottom of your Zoom window, and we will answer all questions at the end. So let's get started. One of the key strategies involved in taking your engagement, education, and adherence programs from acceptable to exceptional, and thereby improving both patient and HCP experiences and patient outcomes, is stratification. So specifically, you want to stratify patients by measures of positive outcomes. You'll also want to stratify HCPs by technology savviness and specialty drug familiarity. And there are many other factors that you'll want to use to stratify your stakeholders. And I will let our panelists get to those. So let's start off our conversation with our first question. Based on your experience, what are the best ways to drive positive patient and HCP experiences and outcomes? How about Brock, you start us off?
Thanks, Bridget. Yeah, so I mean, I think you summed it up well when it comes to stratification, and we talk about this all the time, but you have to meet those providers and patients and caregivers where they're at in their lives and in their workflows. And that can't just be a one and done exercise. It has to be continuous. You have to constantly be reevaluating the needs, the challenges, the preferences of those patients and providers throughout all the journey, right? So from an HCP perspective, there's a lot of things we recognize. Certain specialties are very adept at using their EMR to complete just about all their enrollments. And then there are other practices who are very much maintaining their practice by fax and by paper, and you need to be able to support them as well. And then there's some that really understand for complex therapies, a portal or an e-solution is the way to go. But regardless, it's kind of our job to identify areas to shift HCPs to those types of e-solutions that are going to alleviate any kind of burden on them and just generally improve the experience for that brand. And then, of course, for patients and caregivers, it really depends again on their risk profile, their needs assessments, their preferences for communication. We look at patients who are taking medications at night. You have to be available, whether it's by chat or by phone or by text. For eye disease medications, having larger fonts in your resources and online. For busy people, being able to schedule their injection training and nurse visits through text or online at their convenience. And so just constantly considering their needs and their various challenges is important. So I'm just kind of repeating what you said, but Jan, what do you think?
What you've suggested, Brock, are really great examples. And some of the things that I would really promote that manufacturers think about as well in that HCP and medical team that are supporting that patient is to really understand the academic center versus the community setting, and then also to understand the different views. So is it an HCP, a physician, is it a nurse practitioner, or is it a PA? But if I went quickly to just a very short phrase, it would be, if you want to kill your program, take the cookie cutter approach. And that is, make sure that everyone is saying the same thing each time a caller has an experience. Also make sure that you play the safety information all up front prior to letting that conversation continue. And then make sure that you are having calls that are placed the same every single time with the same topics to be discussed. So again, no flexibility, et cetera. So that's my thought, short and sweet, but I'd like to actually ask Charlotte to, chime in on this as well.
Jan, I couldn't agree more. It is so important to individualize the approach. Every product and patient population is going to be different, and we have to understand the needs if we're going to set up the most effective program. I've worked with patient populations that are young, have active lifestyles, and they really are looking for those more automated self-service solutions, such as texting or chat or websites with digital learning, and they're not interested in picking up the phone. They want to connect on their own schedule at their convenience. I worked in one really interesting pediatric program, and we started off communicating with the parents. But as those kids got a little older, they wanted to be involved in their health care. So we had to find other ways to engage those kids so we could offer support. And then, of course, I've worked with patient populations that are elderly and debilitated and maybe who require caregivers and really need the one-on-one nursing support. And they appreciated those phone calls from a nurse who could offer support and then really individualize that education. Some patient populations are really going to need to focus more on the caregivers and family members because those folks are key to helping people stay on therapy, and they're carrying a heavy load and need a lot of support. So we know along with any therapy, there's going to be factors along the journey that may cause a patient to drop off treatment. So we need to analyze the data and understand why and when these patients are likely to drop off, so we can identify if people are at risk for being non-adherents. Then we can use some of those tools like the Meriski or quality of life surveys to help us identify patients that might be at risk. And then we can really focus on individualizing their care.
Great points.
Individualize, I love it. No cookie cutter here. So what I hear from each of you is that there should be an optimized balance of tech and talent. And that balance should be tailored to facilitate a stratified approach that meets the patients and the HCP's needs. And this slide right here is an example of that. You'll notice that there are tech-driven and talent-driven services on this slide based on the patient's needs at various stages in the patient journey. That could be from education and awareness at diagnosis. It could be supporting patients as they initiate their therapy and maintain their adherence regimen. And it could even go on to if the patient's disease state progresses or they need to transition to a second or third level therapy. The same can be said for the HCP. So you'll notice on this slide, there are different tech and talent enabled services that you should be delivering to your HCPs at various points of the journey. When the HCP is investigating the patient's symptoms and they discover that the patient might be a candidate for a particular disease state, the HCP will be looking for services and medications to support that patient, especially ones they know their patient will be able to access and access quickly. So brands need to educate HCPs on the available support programs and how to access those programs so that the HCP feels comfortable and confident that their patient will be able to start and stay on therapy. And that actually leads to our next question for the group. So how can you differentiate your brand through education, engagement, and adherence efforts? Charlotte, how about you kick us off?
As a program manager, one of the most successful strategies that I found in differentiating the brand, especially from the talent side, is to make those interactions with patients personal when engaging with them. The relationship is really key in supporting patients to maintain adherence. When a team member calls a patient, I can't stress enough the value of having that same team member staying in touch throughout the patient journey. Developing that relationship so they can share concerns and be supported. Acknowledging milestones, birthdays, anniversaries, personal experiences, celebrating those therapy successes and building on previous conversations. It's valuable to allow the patient and the team members some flexibility in their interactions to meet the needs and establish the relationships. If a patient's having an issue, the team member needs to feel comfortable that they can schedule those extra follow-ups to help the patient be successful. And the patient needs to be able to express a preference for when they want calls or if they prefer text or other communication options. And it's so important that we have the ability to communicate with patients in different languages. We need to identify and adapt whenever patients are having difficulties. You know, for example, if language barriers, cognitive, physical limitations. And we need our team to understand the disease state and the challenges that patients and family members experience when they're managing a chronic illness. For example, if you're working with a patient with cognitive challenges, it's important for team members to be equipped to understand and support patients through this. They may need a little more patience to understand instructions, or they may need a family member to step in if there's complex financial and reimbursement issues involved. And we really need to hire people who are compassionate, good listeners, and share our passion to help every single patient be successful with therapy and improve their health outcomes. We need to build tools into our program to teach staff to identify those patients who may be at risk for stopping therapy, and then set up touch points to help decrease drop-off and celebrate the patient's successes. You know, our team's been really successful with these programs, and we want to bring on staff who share that same passion and vision, because we truly believe that every single patient in our program is precious.
That's awesome. Well, Charlotte, I will say we need more people like you on these programs. You know, my best friend has been suffering from very severe RA his entire life, and I mean, he spends hours, sometimes each month, talking to his point of contact at the hub, because he doesn't have that time and that engagement with the prescriber, and they're not given that ability to, you know, really go deep down into his concerns or his challenges that he's having, especially when he's traveling for work, making sure he's got medication on hand, dealing with insurance changes throughout the year. I mean, it's invaluable that people are first and foremost, you know, feeling like they're cared for and that someone's engaging with them, so that you're picking up on those little details too, where maybe the patient isn't saying something, but they're saying something by not speaking up about something. And so, so good work on that. And then in terms of just having the technology there to support those interactions, as you mentioned, you know, tracking information call by call. It's very difficult to remember what you talked about 3 weeks ago with somebody, let alone 3 days ago. So that CRM platform should really kind of guide those discussions and build on each interaction, so that you're always kind of moving that patient forward and supporting them along the way. So yeah, I'll say that that's probably what I've got, but what are your thoughts, Jan?
No, thank you. And again, Charlotte and Brock, you've hit it right on the head, and great suggestions. You know, one of the things that I think is really important for the brand and whoever is going to be managing and educating their internal organization around what are the education points, et cetera, what are going to be the key thoughts that need to be presented to a patient or provider, is to really understand that there are national guidelines that a nurse can speak to, that the federal government backs in, and so that legal can see what that is. And you can have call guides that have been created around those guides, if you would, so that there's good intervention there. The other then is to go back and do some surveys up front prior to launch with both, you know, key opinion leaders, but from different settings, whether that be a community or an academic center, to understand what they feel their patient population needs. But then also to really interview patients, and not to interview the most educated patient, the most articulate patient, but interview those that have other comorbidities or difficulties, et cetera, so that they can be brought to the front in whatever their issues may be. So I think taking into consideration all these things and then having them appropriately provided to the patient population and the HCPs is absolutely key.
Great points, everyone. Charlotte, I love how you said you want to make sure every patient is precious, and you have a team that feels that way. And Brock, we're talking about your friend and that need for individualized support, you know, feeling like someone really cares about you. And Jan, I do like how you mentioned surveying patients and HCPs to really get a true idea of what their needs are and their preferences are. it's interesting because it actually leads right to the next topic that I wanted to discuss with everyone today. This case study is actually a perfect example of how to implement a balanced tech and talent enabled approach. So this case study right here is an example of a program that AssisterX implemented for education engagement and clinical support solutions for an oral specialty product. This product's patient population was unique in that the patients faced both movement challenges and cognitive disorders. The therapy also had a complex titration regimen, and there were multiple audiences as part of the patient's care team, including the patient themselves, the patient's multiple caregivers, and all of the HCPs involved in that patient's care. So it was a complex situation. What we did is our call center nurses, our case managers, our pharmacy team, they all leveraged the perfect balance of tech and talent to educate and engage these various stakeholders, especially at their point of need and in their preferred communication channel, which is different depending on the caregiver and the HCP. Through ongoing analysis of the program, we identified a need for additional touch points at targeted intervals, and that was based on the identified patient and HCP points of need. So once again, though, I won't get too far into this. I want to leave it up to our speakers to give us some more examples. So that takes us to our next question. Do you have any examples or best practices for tweaking your program based on real-time data to optimize patient treatment outcomes and program performance? Jan, how about you kick us off?
Great question. So as we've already heard from Charlotte, she talked about bringing in individuals who want to have that passion and all those components that are so very important, but to bring individuals who also have those credentials. They may not be disease certified, but you can also educate those nurses within your own program around that disease certification. The other is to understand that reimbursement environment. Medicare, Medicaid, managed Medicare, managed Medicaid, as well as commercial. And then the nuances around that coverage in that commercial environment, and to be able to aggregate that data and to be able to share that so that the whole team understands exactly what's occurring with those different payers. And then looking and mining your data, looking at all the different components, as well as bringing in adherence, so that you begin to see what's occurring in the specific regions. Look at how to improve quality, looking to make sure that the individuals on the team are really investigative and wanting to really improve at all times and not just stay within their own silo, but look across the entire team. Key performance indicators, well and good, should always be put into contracts, et cetera. But also understand that those key performance indicators are very siloed. So they measure maybe a turnaround time around a benefit investigation or a prior auth. But what you want to do is also measure end to end. So how many of your patients are actually going the happy path? How many of those patients aren't, and where aren't they? What's the full length of time that there actually needs to take or be in place in order for a patient to get a dispense? And then how do you improve at any of those aspects? Also taking into play what's happening in your network, what's happening around that specialty pharmacy network, or if it's retail, et cetera, and measuring all of those components. So those are the things that I think are really, really important to be measuring and to have that kind of DNA within your program. The one last thing that I do want to bring up that comes to my mind is around the time period to implement changes. So one, to have the data and have a specific aspect that you're measuring, you're looking to change to see what that impact is, but allowing that time to actually have a difference made. So don't do shotgun approach. Don't change every 30 days or every 60 days, but actually give it time to be implemented, to see and monitor for change, and then make your decisions on that piece. You may want to do it in pilots. You may want to do it only in regions, but those are things to be thinking about.
Yeah, that's spot on, Jan. And I'll just kind of jump in. When you talk about data, in order to make any adjustments or enhancements around data, you have to have data. And it kind of pains me how often we talk to manufacturers who really just don't understand some of the basic information around conversion or drop off, or why did someone drop off, and at what point in the journey do they drop off, so you can embed those intervention points and really elongate the time on therapy for the remainder of those patients. And so there's a lot of different strategies for getting data, but just a couple I'll touch on is more and more, it's really about the ability to integrate. So you want your partner to be able to work with the other stakeholders along that patient journey. In particular, those SPs are absolutely critical, and some work better than others with other partners, but the more you can create data feeds with those SPs, so you're tracking where the patient is in their journey, regardless of whether they started the hub or started the SP, and kind of having a team approach to each individual patient is absolutely critical. Sometimes the data feed doesn't solve all the challenges. So if you have the opportunity to add in an SP liaison or even an IOD liaison who can really create relationships with some of those top 10, healthcare systems, great. Those are ways to really track a patient through the journey longitudinally and be very thoughtful at every step of the way. And then it's going to get creative, right? So how do you leverage your technology to create new insights? So things like those e-solutions or the websites that you stand up, can you create tokenized links so you can see who sent the patient that link and where is the patient at in queue, and are they stuck? And does that allow you to trigger text messages and adherence support, or make outreach to the patient and drive utilization of services? And also you can kind of hold your partners accountable to whether or not they're even pushing patients towards those resources in the first place. So I think that those are really valuable. But Charlotte, what are your thoughts?
Brock, I had mentioned earlier that I'd worked on a program that had really developed a successful adherence program. And one of the things that we did was, on the initial call, we identified those patients that we thought were going to be at risk for stopping therapy. A welcome call can be a great tool to introduce the program and establish the relationship, set expectations of therapy, and then complete that really important risk assessment. We would talk to patients about what their adherence had been like with other therapies they had been on. We'd talk to them about their family support systems, any depressive issues, cognitive issues, what were their expectations of therapy. We would try to identify some of those challenges up front. And if we could identify patients we thought might be at risk for non-adherence, then that gave us the opportunity to stratify those patients so we could individualize the outreach that they received. With that one particular program, we identified if patients were going to stop therapy, it was usually within the first 90 days. So we really put our effort into those first 90 days to help them over the hump. And, with that program, we were able to decrease the drop-off rates. We were able to build up the program and build loyalty with our patients to the program and their therapy. And over time, we were able to obtain an 80% market share with that really individualized patient approach.
That's amazing.
Wonderful. Thank you for sharing that example, Charlotte. So we just have a few minutes left in today's panel. I do want to get to questions from the audience. So let's jump to the Q&A. The first question I see is, what questions should we ask potential vendors to ensure our program leverages the right balance of technology and talent? Brock, would you like to start?
Gladly. Yeah, no, I think we see a lot of manufacturers do this today, but they certainly ask about your experience with the disease state within that category. And I think that that's always really good to do that. I also think too, going deeper into the overall solution set. And sometimes that manufacturer, the partner doesn't maybe have direct experience with a competitor or a product in that category, but the overall solution set and their ability to ideate and innovate and come up with unique solutions is absolutely critical to success of your program, and that should be the measure. References are always key. Talking to somebody that has worked with the partner through the design and implementation process and hypercare and that area where you need that extra level of support, and then through launch, are they delivering or not? But then beyond that, I think rather than just checking boxes, it's important to get a feel for that partner, and do they fit your culture? Do they feel like an extension of your team? Are they fun to work with? And do you see it being something you can build on in the long run as your organizations grow together?
And if there's one thing that I can add to that, Brock, great suggestions. But I was also asked to understand, what are they suggesting for the safety net? What are things that they're willing to do to mitigate risk? So, for example, when you launch, you may not know the volumes that are going to be there. Is there an unmet need? And so what can they do to support that? Or on a transition, what are the concerns with the data, the glossary of terms? How are they going to mitigate the information that maybe the existing organization that you're moving from is not willing to play in the sandbox, if you would? So how can you facilitate that? I think those are all good questions.
Great, thank you, Jan. So the next question I see, what hiring strategies can you use to ensure that every person working on your program believes that every patient is precious? What other options are available if not every person on your program can be oncology certified nurses? I think I'll hand that over to Charlotte.
You know, we need to make sure we're hiring the right people for these roles to interact with patients. We need great customer service. We need excellent communication skills. And it's important for everyone who's interacting with the patient to understand the disease state and that patient population so they can better meet the needs and support them. It's important to teach team members how to manage calls. You know, when I started in a patient support program years ago, I had a patient I just adored, but I really had to learn how to meet her needs, but not talk every day for hours a day, how to control that call, but still meet the needs of the patient. I'm a big believer in behavior-based interviewing, identifying how people have responded when working with previous patients and providers. If we're hiring clinical staff, it's ideal to hire staff with the expertise from that patient population. Your example of oncology certified nurses for an oncology program. But a good nurse can be trained on the disease state. The communication skills and the compassion are the most important traits I want to look for. You know, I hired a great clinician years ago, and her background was a busy ICU unit, and she was excellent. She had exactly who I would want to take care of me if I'd been in a life-threatening situation, but wasn't really the best communicator over the phone. You know, I had to learn over time how to identify those best candidates.
Wonderful. Thank you, Charlotte. So we just have 2 minutes left. There's one other question I see here. Hoping, Jan, you can answer this one quickly for us. What strategies should our program use to address health equity? That's perfect. Yeah.
Great question. I'll just jump in this very quickly. You know, one of the things is to really look at the regions of the country and look at that health equity. And what we mean by that is what are the number of physicians per patient in those areas? What are going to be the language barriers, income ratio, cultural differences, education level of understanding, et cetera, because the manufacturer's program is going to have to solve for some of those inadequacies. And something to take into consideration in those areas.
Big time. And I don't know if I have time to chime in, but I will add that, you know, having community resources are also key for those areas. And sometimes it's up to us to identify them and put them in front of a patient because it solves for gaps in their care that maybe their practice isn't giving them.
Wonderful. You made it. All right. So we are out of time. Thank you all so much for joining us today. This panel is part 3 of our 4-part series. So be sure to register for the final part 4 on the events page on our website. You can also view an on-demand version of our first, second, and today's 3rd part of the series at this website. Our next webisode, Digging Through the Data, will be August 11th at 2 p.m. and we look forward to seeing you then. Thank you for your time today.